Hemophilia B is a type of bleeding disorder caused by a deficiency of blood clotting factor 9. In this mnemonic video, I'll give you an easy way of memorizing everything you need to know about hemophilia B so you'll be ready come test day. It's Christmas morning and you know what that means. It's time to unwrap our presents. This kid must have been really good this year, seeing how we got those fancy new Beats headphones. You know, the headphones with the iconic letter B on the side. Looks like he was so excited he gave himself a paper cut unwrapping his present. This kid's bleeding on these headphones with a B will serve as your memory anchor to hemophilia B. Hemophilia B is one of the 3 types of hemophilias or bleeding disorders you need to know. We sort these types based on which clotting factor is deficient. More on that soon. Like we said, it's Christmas. You can tell by that big Christmas tree this family puts up every year. By the way, this Christmas tree should help you remember Christmas disease, the other name for hemophilia B. A Christmas tree for Christmas disease. Hemophilia B is also referred to as Christmas disease, named after the first person to be diagnosed with the condition, way back in the 50s. With the naming out of the way, let's learn about what clotting factor is actually deficient in this disease. This kid jerked his hands up when he got the paper cut, knocking the battery right out of his new headphones. Notice that this is a 9-volt battery, which should come in handy for remembering factor 9 deficiency. Get it? 9 volts for factor 9. Factor 9 is a blood clotting protein that circulates in the bloodstream. Clotting proteins like factor 9 interact with damaged tissue to trap red blood cells in a clot. This clotting proceeds by way of 2 cascading pathways, the intrinsic and extrinsic pathways. Deficiency of factor 9 can inhibit the intrinsic pathway of coagulation, eventually blocking the formation of a blood clot. This obviously leads to the bleeding that is characteristic of the disease. Since this family celebrates Christmas, it makes sense that there's a small cross on top of that tree, as well as one around this kid's neck. This small cross should help you remember X-linked recessive inheritance, since crosses are X-shaped and this cross is small or recessive, right? The majority of hemophilia disorders are hereditary, and hemophilia B in particular is inherited in an X-linked recessive pattern. This means that it almost exclusively affects male patients, although females may rarely get the disease. Got that? Now let's discuss what kind of clinical symptoms to look for in patients with hemophilia B. I hope those blood stains will come out. Those headphones look expensive. This student's bleeding obviously stands for the bleeding caused by hemophilia B. In real life, this bleeding presents as prolonged bruising or bleeding after injury, hemarthrosis, which is bleeding into the joints, as well as intramuscular hemorrhage. Depending on the severity of factor 9 deficiency, bleeding may also occur in response to trauma or some medical intervention, like a dental procedure. All these clinical symptoms are pretty hard to distinguish from that of other hemophilias. Finally, take a look at that overflowing bowl of potato chips. This family always leaves out a big snack plate for Santa the night before Christmas, and the bigger the snack, the bigger the presents, right? Let these overflowing potato chips remind you of elevated PTT, because the letters in potato remind me of PTT, and there's a lot of potatoes here, right? Elevated PTT levels is a lab finding that can be indicative of hemophilia. PTT stands for partial thromboplastin time, which is one measure for how long it takes for the blood to clot. Specifically, PTT measures the function of the intrinsic coagulation pathway, which is obviously impaired by factor 9 deficiency. As such, the time it takes for the blood to clot will be increased, manifesting as an increased PTT. Besides PTT, patients can also be tested for levels of PT, which stands for prothrombin time. Unlike PTT, which measures the function of the intrinsic pathway, a PT test measures the function of the extrinsic pathway, which is unaffected by factor 9 deficiency. Therefore, PT levels are unaffected in hemophilia B patients. These patients also have a normal bleeding time, since bleeding time measures time to form a platelet plug, which is different than a blood clot. The platelet plug forms in an independent process that is unaffected by hemophilia. So to summarize, hemophilia B patients will have elevated PTT, but normal levels of PT and bleeding time. We didn't symbolize normal PT and bleeding times because these are negative findings that are not present or normal in the disease. It would be really confusing to symbolize something that is not found, right? Before we end the video, let's briefly discuss treatment. Patients with severe hemophilia B will often receive recombinant factor 9 to replace their missing clotting factor. Give factor 9 to replace deficient factor 9. It's not rocket surgery, folks. Alright, that's all for this mnemonic. Let's recap. Hemophilia B is an inherited blood clotting disorder caused by a deficiency in clotting factor 9. As an X-linked recessive disease, it primarily affects male patients. Patients with hemophilia B present with bleeding. A diagnosis is made by detecting deficient factor 9, but may be supplemented by the finding of an elevated PTT. And that's a wrap on Hemophilia B, no pun intended. Time to sort out this mess so we can open the rest of our presents. I'll see you in the next video.